everyone that does hair transplants kind of comes out here and says, that was pretty easy. And when you see people doing a procedure for a second and a third time, you realize that it actually is as easy as it is.
Today we've got something exciting for you. This is a follow-up. Yeah, it's really over a year follow-up. And we have, I know, it's so crazy. I would like to welcome Jon Gosselin back to the office.
Hey, thank you guys. I'm glad to be here.
Welcome back. That's
yeah,
awesome.
so Jon underwent single follicular unit hair transplantation 14 months ago. And you know, at that time, we kind of went through the entire process, and we've had a previous podcast, you can refer to that, on hair transplantation, but we kind of wanted to have his input and his perspective on the entire procedure, the recovery, and where he's at now. So listen, I'll let
you know, the nice part about it is you've had a previous hair transplantation, right. But it's more the old-fashioned, which is you take a big strip of hair from the back of the scalp and then you transplant it. So it's good to see and talk to you about the difference and the experience and what you think worked better, what didn't, and kind of take us through what your experience was like.
So let's talk about the first hair transplant I had. It was, like the doctor said, they took a strip out of the back of my head pretty much, sewed my head back together, and then they harvested follicles from the strip and implanted them in my head.
Do you recall how many grafts they took from the first?
I think the first one, because they did my widow's peak, was over 3,000.
Okay.
So they took a huge swath. It's on an episode somewhere out there. Of course it is. And the recovery was horrific. Yeah. It's like I got in a car accident. My head was swollen. I had to fly back to Pennsylvania. You couldn't wear a hat, you had a bandage, so a million people are asking what's wrong. It was so unbearable edgy. Yeah. I had to sleep in a chair for a good week. It was just super uncomfortable and painful, and that's why I waited so long.
Yeah.
And did it work? Do you feel like the first one did? Yeah, okay.
It did work. But you know, it was new, and they told me it was new and all this stuff. So that one was probably 2007, 2008.
Okay.
Somewhere around there.
And at that time, you know, it worked. Do you think it looked natural?
Yeah. Once it started growing, now the hairs were really fine, and that falls out, and then thicker hair grows in. And I had about 3 to 4 hairs per follicle when they did the evaluation.
Sure.
So you had to like retrain your hair.
Yeah.
It was like so different. Like I used to part my hair down the middle or pull it back, and now I have a part to my right. So you had to like change your hairstyle and stuff like that.
But that's good.
It was
out of hairstyle.
It was like 9 hours.
Yeah.
It was long.
Yeah. And you did that awake as well, right?
Yeah, they did a local and Versed.
Okay.
So I remember I was in and out, but you can feel the pressure, especially when they slice your scalp open.
Definitely.
I'm just being like, I don't have like medical terminology.
No, listen, I get it.
I have patient terminology.
Yeah. And that's good for all of our listeners. So the idea is, remember, this is the difference between FUT, which is follicular unit transplantation, versus FUE, which is follicular unit extraction. And so the difference is, as Jon said, you cut out this large strip and then you harvest all of the bulbs or the follicles from that strip. But it leaves an awful scar, the downtime is much worse. I've seen wounds split open or become infected. And so now, with newer technology, the follicular unit extraction is essentially, we're pulling single follicles at a time all over the hair and then splitting those. As Jon referenced, sometimes a follicle will have 3 or 4 hairs per follicle. And so you can take those, split them, and they can look extremely natural. So, you know, the evolution was the original groupings, which was, you know, the traditional cornrow appearance. Then it was follicular unit transplantation, and then it was this single follicular unit extraction. So how would you say, you know, take us through the experience you had here, compare it to the last one, and, you know.
So, I mean, my hair consultation here started well on my second surgery. It was great meeting you guys, and they really explained everything to the detail, maybe more detail than I actually needed, but
Must have been.
but it was just like all these words, and I googled them later. So it didn't matter. And then they show me the apparatus and how that works. I compared to, it's like a tiny little anteater, and it pulls the things out. But I was still apprehensive about the pain. Like I didn't know what to expect because my first one was so painful. And I told my friend over here, who brought me in to meet you all, Adrian, and she was like, "It's not gonna be bad. It's not gonna be. Everyone does it." I'm like, "Yeah, okay." So the first one was really bad.
Yeah.
But now during the procedure when I got here, it was very relaxing. Now the numbing, obviously, when you stick a needle in anything, it's gonna hurt. But I don't know what the anesthesia is, Novocaine or whatever.
Yeah, we're using lidocaine.
You lidocaine.
Yeah.
So after you get your 2 lidocaines, now your whole head is numb. And they just keep on numbing you until you feel like you have a helmet on.
Yeah.
You feel like you have a football helmet on your head.
Definitely.
But
the good part is they keep doing it throughout the procedure, so you never really have to feel that sensation again. So that's a good part.
The saddest part is I got a haircut and then I got another haircut. So like they like shave you down to nothing, and then the girls come in and they look at where a good graft site would be, and they're telling you all this while you're out of it and numbed. They start harvesting the follicles. They draw a map out with marker and all that kind of stuff, I think, and then they start using the machine. And it's a weird feeling at first. It's like there's like you feel pressure, but you obviously are so numbed. And then they start implanting into the site, and it wasn't painful at all. I don't know how long it took. I was here for a couple hours. I think I did over 1,100.
I think we had closer to 2,600 something like that. So it was, it was a decent.
I was really bald. So, but it was sad because like I got this first hair transplant, which did my widow peak, and now I have this bald spot. So it's like I wanted to do it, and I'm Asian, and I'm not very tall. So everyone taller than me, including women, could see my reflective area. So I have all this hair up front now and nothing in the back. So it actually worked out really well. Recovery, I flew from LA back to Philadelphia. My poor daughter had to do with me. But no, I was fine. I mean, I just wore a hat, a loose fitting cap on the airplane. I couldn't do that with the first surgery because it was like surgery.
Yeah.
And, I just went home and, you know what I did? I took, when it was really itchy, because it gets irritated and itchy, and it was more itchy at the site than it was the harvest site.
Yep.
Like I got ingrown hairs and stuff like that, and I took care of that. But the implant site, like my bald spot, it wasn't itchy at all. So what I did, I took hydrocortisone cream and I just rubbed it on the site so I could sleep, because you're not supposed to scratch it. So
yeah, sometimes
you're like going insane. But that was only a week. When I had the first one, it was weeks. It was like 2 to 3 weeks of insane itchiness, like torture.
Yeah.
Yeah, because if you think about it, they take a really big cut, and that's healing. And while it's healing, it itches like crazy. Imagine there are tiny little punch biopsy sites. And what's nice about it is, as plastic surgeons, one of the most important things, probably the most important thing for us, is making sure that we hide scars for whatever operation we're doing. So if you're doing a facelift, or even if you're doing liposuction, we want to make sure that those scars are hidden so nobody can see them, because you don't want it to be obvious. The old way of doing this hair transplantation, and we were talking about this earlier today, leaves you with a big scar in the back of your head. Eventually, if you do go bald in that area, you've got a huge scar there. And it's a reminder of having the hair transplantation, everyone can see it. This way, it's scarless.
Yeah, no,
it really is a scarless type of hair transplantation, which is a game changer. And for some people that have a lot of hair loss, like if you've had good results, which you've had, you can always get a second session just to get more hair, as long as your donor area has enough hair, which most people it does. We'll get people that come in for 2, 3, 4 hair transplants because they just want a fuller, thicker area of hair. So
yeah, I keep my hair pretty short on the sides, but because of the scar, I go like for the guys, a 2.5, a 3 usually. But this time I cut it really short because I know I'm traveling a lot. I won't be back to my barber He was the same barber for 27 years. I won't be back for him for a while, so he cut it shorter, but I know it'll grow in and I just have to deal with the scar. So like if I come back and do a second one, it'll probably be over the scar. I know my donor site's probably pretty good.
Yeah, you've got plenty of hair in the back. Now, now after surgery, tell us about what you took. Did you take any supplements? Did you do any topical solutions? Anything like that, so we can kind of talk about what's a good protocol, because we have a certain way we want to set it up for people, and other places have other protocols, but what did you do?
So John gave me kintsugi, am I saying that right?
Yes, definitely.
Yeah, that stuff's awesome, and I used it all.
Yeah, we have more for you.
Yeah.
The Caranu is a supplement that has horsetail powder, saw palmetto, the usual biotin. The funny part is we all think that biotin is good for hair, skin, and nails, but there's never been any data to show that it actually is. But we do have some studies on horsetail powder and saw palmetto, which actually it inhibits the conversion of DHEA into DHT, dihydrotestosterone, which is the aging hormone, and in doing so can lead to hair growth, just because less hair falls out. So we use that afterwards. I always give the same analogy when it comes to hair transplantation. We have to take a supplement which prepares the soil, and then we plant the bulbs, and now you have to do something, you have to water the grass. And that's where not only did we have the Caranu, but we also have some of the kintsugi products. There's a special shampoo, there's an awakening mist that has redensil in it, which is twice as effective as minoxidil. So using some of these at the appropriate times can maximize your potential outcome.
Listen, I just did what you told me to do, and it smelled really good.
Yeah.
And now I had more bottles than my daughter in the shower. So now
I love it, exactly.
Yeah. So I'm very basic. I'm like, just do what he tells you to do.
I like it. And I give you the
yeah.
instructions, you follow them. I love it. And tell me about your result. What are your thoughts?
Oh, I love my result. I mean, I don't normally look at the top of my head, but people, you know what? A lot of women ask me what I got done. Because you have recovering cancer patients or hair loss or from chemo or whatever. Light-haired women always ask me, "Oh, so it's thicker, and you used to be bald, and now you're not, and where'd you go?" And so I have to go through this whole spiel.
Yeah.
What we're talking about, but they're very interested. Guys, I'm just gonna shave off.
Yeah.
You know what I mean? They don't want to really go through. I mean, I live on the East Coast, so it's a little different. Out here, it's like you look around, and you're like. Where?
Everyone's got
hair.
Everyone's got hair, everyone's thin, everyone's running on the beach at like 5 o'clock in the morning.
It's a different.
I'm coming home at 5 o'clock.
It's a different ballgame.
It's different. Way different.
So what I would say for all our listeners, again, I think single follicular unit hair transplantation, great result. Now how can we maintain? Because remember, you're still losing some of the hairs that would normally fall out, right? So the transplanted hairs stay, but you're still losing. So we have to do something to hang on to what we have. And so I would say in the algorithm of hair transplantation, the next step would be exosome. So people, listen, forever we've been doing PRP or platelet-rich plasma injections, and those can be phenomenal, maintaining hair follicles. I think newer regenerative medicine technologies are slowly emerging, and this is where exosome therapy is going to be phenomenal. So exosome injections, these are the little microvesicles that carry all of the growth factors that can actually turn on a dormant or senescent hair follicle. So, now we've got actual growth. This is the next step. And if that doesn't work, then we move to a second transplantation. And the idea is, again, the transplanted hair stays. So we can always take those hairs from the sides and the back, and transplant on the top. You have a thicker head of hair, and you don't have to worry about it.
And some protocols will also put in things like Propecia. Propecia is going to actually help you with orally stopping hair loss by conversion of what Dr. Layke just talked about. With there's the aging hormone or the hair loss hormone. So Propecia will it's an alpha reductase inhibitor. We're not going to get into this whole spiel of how it works, but that's one other way of really helping maintain your hair that you have so you don't lose more, plus or minus either redensil or minoxidil. Now there are some new studies that show that you can take oral minoxidil. There's not enough data out there, but the studies are very, very, very promising that not only will it help with hair growth, but it also will help have you not lose as much hair. But until those results and studies get out there further, I wouldn't go out and run out and buy minoxidil orally. It is an antihypertensive drug that has been used for years. So the dose is significantly lower when it's done for hair loss. So we'll keep you updated on that. It's something very exciting, but we still don't know how to really use it. I've been thinking about doing this. So would you recommend this to whoever your friends or other people?
Oh yeah, absolutely. It's not invasive. Recovery time's quicker. Great results. No scars. You know, and you can continue to do it as long as the donor site's good. So
Yeah, just a win-win overall.
Yeah, if you think about it, I'm asking him. We do this regularly, but it's much easier. No, but it's much easier to really get it from somebody who's done it.
Mm-hmm.
To get a real experience from a patient is much easier than with a doctor. Because I'm operating on people all day long. I'm like, it's a piece of cake, do it.
Yeah.
And then some people are like, man, that life selection hurt, or man, that was difficult. But everyone that does hair transplants kind of comes out here and says, that was pretty easy. And when you see people doing a procedure for a second and a third time, you realize that it actually is as easy as it is. So, yeah, thanks for coming in today. This is great.
Yeah, I mean, like after the first one, I was like, no.
Yeah.
No.
Yeah.
I'm not doing that again.
You know, we have patients like that come in, they've had procedures elsewhere, you know, and every physician or every plastic surgeon has their own protocol. And sometimes, you know, we learn from other physicians. If we hear of a better protocol or we hear of something where the patient had a better experience, I want to know why.
Mm-hmm.
Because, you know, I can't tell you the number of patients that come in for revisional surgery. They'll tell me that it took them, same thing, and it took them a long time to get there because they had such a bad experience. And then we go through one of our protocols, they say, gosh, it was so easy. Not to say all of ours are like that, but I think we've got a pretty good protocol for getting you ready for surgery, the procedure itself, and afterwards to make this as a comfortable experience as possible.
Yeah, see, my father was a dentist, so I'm gonna metaphorically speak. The first procedure is a root canal with no this procedure is like just getting your teeth clean and maybe you have a little gingivitis, so they gotta get in there a little bit. But